Welcome all, welcome to this AimExcellence AVD discussion, and today we are going to talk about one important test that actually have been done in the All India Institute of Medical Science, New Delhi. And this test is APTAMER test, where they found it diagnosed both pleural and pulmonary TB with huge efficiency and at the quickest time. So it diagnoses both the pulmonary TB and the pleural TB too. It has been confirmed. Also studies are going on TB meningitis to diagnose it from the sputum and the pleural fluid. So for pleural TB, they need to tap the pleural fluid but for pulmonary TB, they actually can diagnose it from the sputum itself. From the 2016 data, the total amount of patients with tuberculosis in India the total amount of tuberculosis cases in 2016 is 2.79 million. It's the most cases across the globe. Across the globe, it is the most cases in India only. So it can be called as tuberculosis capital. And most importantly, even in Tamil Nadu, recent studies have shown there is coexistence of diabetes mellitus and tuberculosis in the many cases that have been published in the journal already. Why we are sharing this information? Because in Central Institute examination, particularly one Central Institute examination, they have the tendency to ask the journal based MCQ. So that is why we are sharing it. And why we are sharing it today? Because 18th November there is a chance of sunstorm that is going to hit the earth. So there are chances of breaking the connections, internet connections, all are not going to work. So that is why we are uploading this video today. So coming back to the topic itself, the test is APTAMER test, which is actually checking the ssDNA, single stranded DNA, which is actually coupling with one target molecule, and that is actually going to be investigated, this whole combination. Now we have talked about the sensitivity and specificity. In sensitivity of pulmonary TB for APTAMER test is 94%. For pleural tuberculosis it is 93%. And the specificity are 100% for the pulmonary tuberculosis and 98% for the pleural tuberculosis. So this is a very efficient test. For pulmonary tuberculosis, we can diagnose the condition from the sputum itself, but for pleural tuberculosis, we have to take the pleural fluid. And there are two types of tests. One is the spot test, that is the preliminary test, that the result we can expect within 30 minutes. So we can diagnose a patient within 30 minutes. Whether the patient is having infected by Mycobacterium tuberculosis, or actually it's not identifying the bacteria, it is having the tuberculosis or not. And the main test, total laboratory test, the result can be obtained within the 5 hours. The alternative which was present and which have been asked also, that was expert test. Expert test, that expert test have the sensitivity around 22%. So APTAMER test is giving the encouraging result much quicker. So our focus is to ensure to make it actually coming to the public and making it cheap enough, and if possible government will fund it, so most of the tuberculosis cases can be diagnosed easily. I have seen one patient very recently who was having the tuberculosis, and initially doctors would not be able to, even from the private hospital, cannot diagnose the condition from the sputum itself, and it is very common thing. You have to diagnose the tuberculosis cases, and there are many almost MDR TB cases right now in India, and there is 33% of them are treatment failure till now. The data is like that. So we have to diagnose the case, and that is where the APTAMER test is of huge benefit. If you like this kind of presentation, continue to follow us in the YouTube, Facebook and Twitter. Write to us in our Facebook pages message boxes. We are little busy right nowadays. We have other projects to work on, and because bunch of people, youngsters, are going to give examinations, we are actually overlooking that. And if you have any queries, you can write to our pages message boxes, and we are going to get back to you with the answers of your queries within 72 hours. So you have to be little patient, because our updates are going to be Mobitz type 1. So, but it is going to be with the increasing interval. But sure shot, you are going to get your replies within 72 hours. Thank you for being with us. Thank you for supporting us. We are really thankful for your huge support across the globe. Thank you.